Good morning. I want to welcome all of you to our workshop today on caffeine in food and dietary supplements, examining safety. It is my pleasure as chair of this committee to present to you for the next day and a half what I think is going to be a wonderful series of presentations. We have had a great task as a committee, as given to us by the FDA, to try to bring together for you the best available science that, as it pertains to caffeine and similar products, the exposures, the potential health hazards, vulnerable populations, and some explorations about safe levels. I want to remind all participants here today in Washington and also on the web of the fact that this is a workshop of the Institute of Medicine. As a workshop, this is a process that is going to be an examination of scientific issues. It's going to provide an opportunity throughout the session not only to hear some excellent presentations, but also to be able to ask questions and have some discussion and dialogue among some of the scientists that have been invited. Our committee members came together to produce this workshop for you. We are not asked to develop a consensus about these issues. We will not be presenting a consensus report. The staff of the Institute of Medicine will be presenting sometime this winter a workshop report that will, as accurately as possible, reflect the actual presentations that have been heard here both today and tomorrow. The scope of these discussions, if you know about the National Academies risk assessment paradigm, where we talk about risk assessment and then risk management, that this is all about the assessment of risk, basically. We're and the various elements that have to do with risk assessment, exposure assessment, dose response assessment, the ability to integrate that information in terms of thinking about safe levels. But what we will not be discussing in any of the scientific presentations is risk management. We will not be going to the various authorities of FDA and the ways that FDA has to manage these risks. So without further ado, I want to go ahead and move to the actual substance of the workshop. This workshop is sponsored by the Food and Drug Administration, the Center for Food Safety and Applied Nutrition. And we have the pleasure today of having Dr. Margaret Hamburg, Peggy Hamburg, Commissioner of Food and Drugs at the FDA, to give us some opening remarks. Dr. Hamburg has served as Commissioner since May 2009. As FDA Commissioner, she is advancing regulatory science, medical product innovation, and globalization of the FDA, while overseeing the implementation of groundbreaking laws to curb the use of tobacco and enhance food safety. In addition, she has undertaken major efforts to streamline and modernize FDA's regulatory pathways, as well as to enhance the scientific basis for decision-making at the FDA. As many of you are probably aware, she's also a member of the Institute of Medicine, a very distinguished public health scientist in her own right. Today, she will share her perspectives on examining the safety of caffeine in foods and dietary supplements. Welcome,